It's a 21-bed unit that cares for newborns, infants, children, young adults and some older adults who have heart disease. We look after a combination of medical and surgical patients. Most of the patients have had heart surgery or are due to have heart surgery. But we also have a large heart failure program and transplantation program here. That means that around about a sixth of our patients are actually medical patients who have problems with heart function. They're waiting for heart transplants, some have had heart transplants. And then we also have a very active mechanical support program which allows us to place the very sick children who have heart failure on what's called mechanical devices that help their heart function and hopefully bridge them to a time where they're lucky enough to get a heart transplant. So the CVICU is on the 18th floor of Texas Children's Hospital. It's within a 4th floor area which is a heart centre. It's right next door to the cardiac operating rooms, which has lots of advantages for us. It means we have an easy dialogue with the heart surgeons. They can pop in and out of the operating rooms to talk to us and update us about progress of patients in the operating room. And it's also next door to the cardiac catheterization laboratory where patients have cardiac catheters or angiograms, and a few children every month will come to us from the catheter lab if they've had a very extensive procedure. The CVICU has a big team of nurses, of respiratory therapists, of physician assistants, nurse practitioners, and of what we call cardiac intensivists. Intensive care is a very high-tech environment, whether it's general, cardiac, trauma, neurosurgical. It's full of machines that make noises and bells and alarms, etc. In the cardiac ICU, we do all of those things. We've got lots of monitors. Typically a patient after a heart operation is attached to a breathing machine or a ventilator which takes over the work of breathing during the first hours after surgery. And our patients are also attached to many syringe pumps delivering drugs that help the heart function, that help them to stay out of pain and stay asleep after surgery. Some of the other devices we use in the ICU if patients are more critically ill include dialysis circuits and also heart-lung machines, which we call ECMO. It's a machine that we use to support heart and lung function in very, very sick children who really can't cope without a machine to do the work for them. And the other types of machines that we have in the cardiac ICU are called ventricular assist devices, or VAD. And what a VAD machine does is it takes over the heart function of children, babies, children and young adults with severe heart failure. Really, we're very, very keen to continuously improve our practice. We have regular CVICU morbidity meetings where we review our monthly data, we look at complications, we look at adverse events, and we try and channel in a process-driven way our goals for the next few months and see how we can actually improve our practice and prevent adverse events from happening.